Hi, I'm Liz. I'm the neurogenetics and ataxia nurse specialist at the National Hospital.
What do you do here?
I see, in the ataxia clinic, I see the patients along with Dr. Junti. So we discuss different problems that they have or things we can help with, like providing physiotherapy or occupational therapy, helping with assessments for grants, and generally trying to help out with various practical problems that patients have.
And they can also phone you, isn't that right?
Yeah, patients often phone or email me in between visits to tell me how they're getting on. If a patient changes their medication, I contact them to find out how they're getting on, and we titrate the medication over the phone so that we know what's helping them. And also I have phone clinics in between the actual hospital visits, so just to check how patients are getting on. So if a patient needs anything like a physio referral or something like that, they don't have to specifically come back. I can do that after speaking to them on the phone. So it's quite helpful for patients who come from quite a distance.
Yeah. Okay, and why do you think it's important to have these specialist clinics?
It's important for rare diseases because patients often say that they've seen local doctors and they've never heard of ataxia, and obviously our patients, have been identified as having genetic mutations as well, so they might have spinocerebellar ataxia type 1 or type 2 or type 3. So if someone's never heard of ataxia, the nuances of the differences between the different types totally escape them. And also it helps for all specialist clinics. If you see a lot of patients with the same thing, you learn things to look out for, and you have networks of people who know about the disease, whereas if a doctor only sees 1 or 2 patients a year with a problem, they're not as used to seeing different things, and it's easy to miss subtle changes.
Yeah.
In some ways the clinic is only, part of it. I could get 20-30 calls a week. So if you counted those as, things we have to sort out for patients, queries about drugs, patients telling you things have happened, such as if someone's had a fall and they're in hospital, or often GPs ringing to ask for advice because they haven't seen anyone with ataxia before. If someone's admitted to hospital with a problem, with the doctors there don't know anything about ataxia, so giving them advice. So although you could say, well, it's 1 clinic a week, but the volume of work is tremendous.